Okay, the doing interventions. Oh, there's the photo to go with that. So let's look at the interventions in functional family therapy. So in the initial sessions, you're trying to move from a blame-focused definition of the problem to a more family one. And so kind of expanding, and this is very classic in most family therapy approaches, you're moving the blame away from just the individual and expanding it to how the family has responded to some of these challenges or responded to challenges from the broader societal system, right? And you're going to be doing a lot of reframing, helping them to see how their individual behaviors fit as part of the larger interaction pattern. So reframing maybe a child's defiance to, them wanting to assert independence as they hit adolescence, right? And trying to soften some of those descriptions, reframing the parent's authoritarian, strict curfew rules, right? Around, as a form of showing that they care and love their child, that they're invested and they want the best for them. So helping families to see that, identifying the relational sequence or pathologizing interpersonal pattern. So this is a very classic family therapy intervention, systemic assessment of, person A, does something, then person B reacts to that, to which A then reacts as well. And you normally, can create a negative cycle or a positive cycle. With conduct disorder, very common pattern is, a child breaks the rules, the parents, use punishment, and then the child breaks a rule again, the parent uses a harsher punishment, right? And the harsher the punishments get, the more exaggerated and the more outrageous the child's behavior. So you can have that type of negative interactional sequence. You can have a sequence where the child acts out, the parent, ineffectively sets a rule and a limit. They set a consequence, but don't enforce it. Child acts out again. The parent does it bigger, but they actually don't enforce it. So you can also have, there are lots of different variations, and you need to understand exactly what this family is doing differently to get that pattern. This can be assessed indirectly. You can do it by just watching their behaviors, often just even what they're doing in the waiting room and what they do walking down the hall to how everyone finds a place to sit in your office. You normally get a ton of information. And then certainly when you're asking them questions, who's talking for whom and how does all that work? And then obviously from the family's description of the problem as well. So relational reframing. This is a very classic family therapy intervention. You'll see this in many of the family therapy approaches, but it's a cognitive restructuring, and it's a form of cognitive restructuring in terms of helping the families change their interpretations and meanings around the problem. So rather than seeing all those parents' harsh rules, to see it as a way that they're trying to protect their child. Maybe, it is a dangerous neighborhood, or and so the parent has these rules as a way, as their way of trying to protect. And trying to reframe relationally, focusing on reducing any malicious or negative attributions about either the parent or the child, and ways to increase understanding and hope, right? And so if we can find a way for you to hang out with your friends in a way where your parent feels like you are safe, then that could be a win-win for everybody. So they have 3 phases for relational reframing. It is acknowledging, a particular dynamic or a unique individual person's experience. It feels like your parent's very authoritarian, let's say, or it feels like your child's very rebellious. Reattribution, offering a different way to reframe it, with better, your parents, are worried about your safety and cares about you. And for the teen, you're trying to figure out and test being a young adult and learn how to exercise your independence and to build confidence in that way. And so assessing the impact and building on it. So helping them, assessing how that reframing affected them, and then continuing to build on these new attributions and new ways of seeing each other. And so this is something you're going to be you just don't do it once. It's continual kind of rebuilding. I often think of it as like building a new reputation for each person in the family. And so it's something you're going to be continually doing across sessions. If the parent has been seeing the teen as disrespectful and rebellious for years, One reframe is not going to undo that. And if the teen sees their parent as an unreasonable tyrant and been seeing them that way, in a control freak for years, it's going to take more than one session to get over that. So you're going to want to be, you'll be doing this across sessions. And so, and building evidence for this new way of interpreting each other, I think, is real important. So looking for at specific things that happen from week to week that support the more positive description of each other rather than the negative one. And of course, this gets fine-tuned over time. They talk about building these organizational themes, and this is how they describe problematic behaviors are actually motivated by positive but misguided intentions. So, such as the rebellious teen who is wanting to to grow in their ability to be independent, right? So the intention is good, the expression is misguided. And same with the parents who are overly protective, wanting to make sure their child is safe, nothing bad happens to them. You hear so many scary stories in the news. They're doing their best to make sure those scary stories don't happen in their family, right? And so really working on helping them reattribute positive qualities to one another, helping to describe the origin of the problem without describing any one person. So often looking for societal level descriptions of the problem, or community, school, neighborhood. So looking at how it's usually not just the parent and the adolescent by themselves. There are all these other levels of the systems that we are a part of: school, community, culture, society, right? And how all of those factors play into, let's just say, the fears that the parents have, and the desire the teen has for more freedom. So also looking at all of those dynamics too, because there is no family that is having these issues that isn't influenced by a lot of other external narratives, discourses, influences as well. So, and hopefully this is mutually developed, not just the therapist giving it these themes to the family, but having the family therapist, the parents, the adolescent, and the therapist working together to develop these kind of organizational themes. And oftentimes by naming them, and identifying how, let's say, the school or societal discourses or cultural discourses have been at play in what's going on with the family, that you can have just more hopeful conversations and move things forward in a positive direction. So parent skill training is definitely part of this process. So helping parents to be more effective using current scientific literature. There are 3 areas of focus: being able to have clear expectations and rules, creating mutually agreed upon and appropriate behavioral expectations that are concrete and specific. So this comes clearly out of cognitive behavioral therapy. And this is an area that most parents I meet with today, it's a weakness. I think at a societal level, we we are not good at this. And I think most parents feel like there's a lot of pressure to be empathetic and understanding and not cause stress in youth, which often translates incorrectly into, I'm not going to, have a lot of rules or a lot of expectations. And we've kind of, you see parents swing to a very permissive style, which actually can create conduct disorder. Just so you know, if you're super permissive, super empathetic, you can actually create conduct issues just the same way that authoritarian parenting can do that as well. So a lot of parents I work with need a lot of help in this area. Many people have way too strict of rules. One of my favorite interventions with adolescents is to have the adolescent come up with the rules and the consequences. They're usually much harsher than what the parents would do, which then the parent and I can work to lower some of the teen created consequences, which, helps the parent, look a lot better. But if the teen comes up with some of those rules, it typically results far better than when the parent does it. And it also helps the parent have confidence that the teen actually understands. And often the parents feel very seen, heard, and validated when you have the teen doing that. So ensuring that the parents are actively monitoring and supervising their teens. And so we don't want to, encourage a ton of helicopter parenting, but knowing where your children are at, who they're with, right? And to be involved at that level rather than just letting them roam, especially if they're getting themselves into trouble with a lot of freedom. So making sure that the parents are monitoring at a certain level that's not overbearing. And then just being very consistent. So normally most parents and most teens, if you ask them, they're going to propose consequences that are way too harsh. So parents are burning themselves out. They're not following through and they become inconsistent. They're like, you're grounded for a week and I'm taking away your phone and this and you can't go out, da, da, da. And they like, basically lock them in prison. And then after 2 days, the parents going crazy with the kid, being at home with nothing to do because they took everything away. And, that's not good parenting. That's not effective. So, helping parents and, really have reasonable consequences. And if anything, err and going on them being too small. Because as long as a parent has a reputation for being consistent, that whatever they say they're going to do, they do, you're going to have a much better working relationship with the teen than if sometimes, they threaten these horrible or they, consequences and they say you're going to be grounded for a month and they're grounded for a day or two. That is not going to work. So I have, it's, something as simple as taking the phone away from 10 minutes versus a week. I have had incredible results because the parent is consistent with it. The teen knows it's going to happen and usually they get with the program. So, something to think about. So that parent skill training is really important because there's so much bad parenting information out there. As a parent of teenagers right now, there's just so much bad information out there. And so, I think it's important for clinicians working with families to really understand how to help parents be effective. And then looking at mutual problem solving. So this is parents and teens working together to solve problems that are coming up, right? And to solve these problems in ways that strengthen the parent-child relationship. And so you're typically going to be identifying what specifically is the problem, right? Maybe it's curfew. What's the identified desired outcome for both the adolescent and the child, right? And sometimes for some teens, it's more like they just don't want the parent to show up at their friend's house or whatever it might be. So, you need to ask, don't assume what the desired outcome is. Then looking at how we can agree on how to accomplish the goal, and it could be, getting the grades up or whatever it might be, identifying the obstacles, and then evaluating how things go. So helping, families really come up with a system for mutually solving problems that, is agreeable to everyone and where they work together to work through obstacles, identify those potential obstacles and figure out how to work through them when they come up until they're able to solve whatever issue it is that is in front of them. Conflict management is another set of skills that functional family therapists teach their clients. And so and teaching parents and teens how to have, effective conflict, resolution skills are really important. So things like being focused on a specific issue, let's one issue at a time. Let's not throw in four other, arguments, which is a really common thing to do, dragging in unresolved issues from the past, trying to develop a conciliatory mindset and willingness to talk about the problems, right? Having the therapist set an emotional tone that helps reduce conflict. So just, having these conflict management conversations first in session with the therapist facilitating it and setting the right tone, role modeling that you can have differences of opinion, you can be hurt, and you can still be respectful with each other. And let's figure out how to have healthy conversations where we have strong differences of opinions or one of us is hurt. Staying oriented in the present, and so the therapist will help them reduce the conflict, And if they're highly volatile issues, right, you want to wait till you can have a productive conversation on those topics. And the clinician being the one to determine, where, when, and how you'll often be very directive in these sorts of sessions to help shape healthier ways of communicating around difficult topics when people are charged. Leads us to communication skill building, and yet another area of skill building. So this is where a lot of these interventions come from cognitive behavioral therapy, where there's like a psychoeducation component here. So you focusing on lots of different areas of communication. So helping people take responsibility, being direct in their communication, saying what you mean, meaning what you say, being brief, especially parents. Man, most parents talk too much, lecture, right? So working on the brevity, being concrete and specific, naming the exact behavior instead of saying you're being disrespectful. That doesn't mean anything to me anymore. I have parents, describe what that means. Teens saying, that's not fair, or whatever they might be saying, get really concrete and specific when they say these things. Congruence is where your nonverbal communication matches your verbal communication, and you can coach both, the parents and the teens to be congruent in their communication with each other. So helping oftentimes with parents, oftentimes because they're having to be the disciplinarian, a lot of the care that is also underneath the rules that they're trying to enforce, helping that bring that out. And oftentimes with adolescents, appreciating that there is care there as well. So having that congruent communication, active listening, so really listening to each side. And then matching to fit the family. So this is a real key concept here. And so you want to introduce new behaviors for the family that really fit with the particular family's personal style, cultural style, education level, for example. So, for example, if this is a family that is more comfortable than you might be with more emotional expression, you don't want them to, force them to communicate in ways that feel like they have a straitjacket on. If it's a family that tends to, be emotionally expressive, you want to find ways to teach communication skills that fit with their natural way of communicating, not just what you think is the ideal way. So again, there's a lot of this not imposing the therapist's ideals onto the family, but working with the family to figure out what is the healthy, right, natural way for them. So you're going to be looking and so if you're targeting the interaction patterns, of a family, you're not going to go for some textbook version of it. You're going to go for something that makes sense to this family. So for example, if you're working with a family and where they get really heightened arguments, you may think that you want them to take this hour-long time out, but there might be another way that works better for them, right? You might want to give them that, talking stick to go back and forth, but that may be so just not how they communicate. And so you want to be really sensitive that you are matching their natural style. And that can be culturally informed. It can be informed by education, right? And gender as well. I've seen a lot of female therapists try to coach male clients into communicating more like a woman because that's what's familiar to them. And you can see this vice versa, men trying to coach female clients to communicate more like, a typical how they communicate. It can be a gender, not just cultural style. There's a culture by gender variables there. And so being very mindful that you're not trying to coach someone to communicate the way you think or, interact the way you think, what you could do, especially when you're working across various genders or ethnicities, cultural backgrounds, and race. You want it to be natural for them and your client. Yeah, and again, helping them find more effective ways of maintaining the same relational function in terms of hierarchy, closeness, and independence to help them achieve those goals in ways that are just more functional and fewer symptoms. So, and again, you can link these interventions back to the organizational themes we talked about, right? So maybe how society, their role in society could be an organizational theme that were identified in earlier treatment. And that creates a sense of coherency and continuity across all of treatment. And I always think of that, and this where I'm probably bringing in a little bit of narrative therapy here, but building those identity narratives that I think are really key to maintaining gains. And now I'm slipping into my unifying frameworks. I'm going to come back strictly to functional family therapy. So research and the evidence base. It is one of 4 widely recognized, well-established family therapy treatments for adolescents with conduct issues, and it is moderately superior to other forms of treatment. So this is a very, not just equal to or effective for, it is moderately superior to other treatment as usual. This is the first to have an efficacy study conducted by independent investigators. So the rates of adolescent recidivism and relapse have been correlated to the therapist's adherence to the model, meaning therapists who follow the model more strictly tend to have better outcomes. And so this has a strong evidence for treating youth with conduct and with youth with substance use disorders. In terms of ethnic, racial, and cultural diversity, it is widely used with, but not necessarily widely studied with, diverse populations. In this approach, it is very central that the therapist respects the client's cultural norms and values and works within those rather than imposing some kind of theoretically neutral framework. And so in acknowledging the relational function of the problem and exchanges and helping the family to find more effective ways to meet those functions that are culturally, religiously, appropriate for the family, and adapting the goals and, exactly what the expression of the function is to meet the family's cultural norms or to honor the family's norms. And, allowing and including both addressing often collectivist cultural norms as well as individualistic values. And so that's something you'll often see when working with conduct disordered youth. Often the parents are coming from a more collectivist background, perhaps they're immigrants, and then their adolescents are taking on more individualistic values. And so being mindful of that, tracking that, working with that, there's no simple answer there is all I can tell you. So if you think you've got a simple answer, you're biased. So you're going to work with your clients to find ways of honoring both sets of values. If both types of values are important, which with the internet, no matter where you are on the planet, both discourses are easily available to youth around the globe at this point in history. And so helping families figure out how to navigate that with respect for each other, with grace for each other. And then in terms of working with LGBTQIA plus youth or families, there's been less around functional family and youth who identify LGBTQ. So, but looking at their organizing theme around some of these issues, especially kind of depersonalizing some of the struggles. And if LGBTQ are not fully accepted by their families, looking at ways to create their own families of choice, often. And whoops, went too far. So having family members, whether these are family of choice members here, can also be involved in the treatment if necessary, if helpful. So that can be if you have a supportive aunt or uncle that's who is supportive of the LGBT youth, that it could be appropriate to bring that person into treatment. Again, you are always looking with multiple systems, broader systems, looking for the supportive figures in an adolescent's life and trying to use those supports to reduce the risk factors. And then in terms of telehealth, functional family therapy has been successfully used online with families because my experience is it's got a lot of cognitive elements, a lot of psychoeducational elements, both of which tend to translate well into telehealth and online environments. Okay, so that was an introduction to functional family therapy. I know many of you might be using these in your fieldwork placements. I think it's a really lovely, streamlined approach to conceptualize working with adolescents with conduct issues, with substance use issues. And I'm going to go ahead right now, and it looks like there's some questions in the Q&A. And and see what I got here. Oh, we got some where folks are from. Got people preparing for the exam. So if you're taking the national MFT exam, you're probably not going to see a lot of functional family therapy, one or two questions at the most. But what I like about it, I think it's a really great way to conceptualize structural and even some systemic treatment planning. It has some of the cognitive behavioral family therapy in there. So in that sense, I wouldn't necessarily memorize all the elements, but I think if you've listened to this in preparation for taking the exam, it's a great example of how to work effectively with conduct disordered youth. So, there's a question about what are your thoughts about using functional family therapy for youth with ADHD? There's a lot in here that would apply to working with youth with ADHD because it is a conduct issue or behavioral issue, and so all of these things I think translate nicely. I don't know if there's specific research. I'd have to go look on that, but because ADHD is very behavioral, right? It's going to be a very small step because, looking at the hierarchy, is it appropriate? Is it functioning? Look at the closeness versus independence, right? That's all stuff you want to look at with ADHD. And then doing, work around conflict management, problem solving, all of that, and parenting skills, very central to treating ADHD. So I think there's a lot in here that works very nicely when working with adolescents diagnosed with ADHD, and many of them end up having conduct disorder. So it's easy to find both. Oh, there's a question. What would be an appropriate alternative to saying you're being disrespectful? Um, I'm guessing like to a youth right now. So another alternative is let's say it's a teenager being very disrespectful or dismissive of a parent. You could do something along the lines of, what do you think it's like as your mother or your father hears you saying this right now? How do you think they would interpret that, right? So something like that is a way to another one is to ask the teen, so what is your intention with, I don't know, telling your father that he is stupid? What are you underneath that? What are you hoping to achieve by that? Or what's your intent? And you can just be curious about where that might be coming from. It depends on the context, obviously. Okay. So please comment on working with functional family therapy with low and middle income counties or countries. I'm not sure which. So yeah, so this a lot functional family therapy has been used, I think, widely with a lot of lower and middle income families who end up with that diagnosis probably more often than not, and for lots of I think societal reasons, not family reasons. So these approaches and the other three approaches that are similar in terms of evidence-based treatments for conduct disorder are widely used with low and middle income families. And I think that's why that emphasis on respect in the beginning is so important. Because even if you come from a lower income background, but you've gone to graduate school to be a therapist, already, even if the family is from your own background, being an educated expert in it, you're up here. And so you really want to not skip over and really emphasize the respect piece when working with lower middle income families, looking at and respecting how they're doing their hierarchy. Oftentimes, what a lower income family is going to look like might have a more of a hierarchy than someone who comes from a higher income family who might, where there's a tendency to value that kind of democratic. Obviously, there are lots of variations, especially when you start looking at culture and gender norms, but it certainly can be used successfully with lower middle income families. But that emphasis on respecting the culture and the family's norms and not imposing your own is critical, because most clinicians are going to be coming at least from a different social economic and education level than their clients. And that's all very correlated with tending to prefer a more democratic family style versus a hierarchical one. And you need to be careful with that. I hope that helps. Can functional family be applied to youth interventions available digitally, or is the role of the therapist more important here? I mean, typically, typically I would say the therapeutic relationship is pretty important. There's certainly, there are four major, I consider them, psychoeducational pieces here: parenting skills, communication skills, problem solving skills, right? Conflict management skills. Those are all those can be delivered digitally. So even like a pre-recorded lecture like this. But I think to really treat something like conduct disorder and work with the family, you're going to need a therapist in there to negotiate those relationships, to help them shift how they see each other. You're typically looking at a very active clinician who is shaping that part. Although components of this, I definitely believe, can be delivered asynchronistically, at least giving them some of that psychoeducation. Absolutely. Okay. Awesome. Awesome. Let's see if there are any other questions here. Um, okay. Very good. People are asking when the next webinar is. There's another one in a couple of weeks. Check your email. And you can also check the Therapy That Works Institute.com webpage. Look for YouTube Live web page there, and you can sign up for the upcoming webinars there. Woohoo, someone just passed their licensing exam. Yay! Oh, woohoo! Congratulations for passing your exam. Um, oh, how difficult is it to pass the MFT? I'm assuming licensing exam. It's tough. I do have a course called Laugh Your Way to Licensure where I do a lot of live coaching in there. I invite you to check it out. It is not an easy exam to get through, but I do encourage you, if you're taking the exam, I encourage you to check out my course. I think it's a really good value for the dollar, in the sense that it is an act of service to give you the training, and you get live coaching sessions with me once a month. Great. Okay. Okay, very good. So folks are enjoying this. Oh yeah, so Nancy's pointing out it's difficult when mom and dad are not on the same page. Um, no, Nancy, if mom and dad are not on the same page, I'm not going to suggest necessarily individual therapy. I'm going to try to get those two parents on the same page. So I will be having some individual, parenting sessions with the two parents to get them on the same page so that they can parent together rather than undermine each other. So those can be tough conversations, but they're important. So awesome, awesome. People really found this helpful, enjoyed it. Mahalo. Aloha, Danny, out there. Very cool. So yeah, Danny's gonna be taking the licensure course soon. So yes, you are welcome to join that. But if you've got any other questions, you can put them in the chat. But otherwise, I hope this has made you feel more comfortable with family therapy in general. I think functional family therapy is a great basic model for most forms of family therapy, especially when there's some kind of child conduct issue at play. And so yeah, so someone who's just joining, this will be live forever on my YouTube channel. We will edit the video and post it on YouTube, and it'll be there is a playlist for family therapy on YouTube where you will also find this, but this will live on YouTube. I just decided, instead of, recording by myself in a lonely room, I'd rather record with all of you all, and it makes probably more fun to stay focused. Great. Let's see. I got a question here from Jeanette. How does functional family therapy address situations where parents are disengaged or exhibit toxic behaviors, especially when working with adolescents who have behavioral issues? Oh yeah, Jeanette, there's a lot of that out there, isn't there? So disengaged parents, you would be trying to re-engage those parents. And again, you're going to be very concrete and specific. So with those types of parents, I'm like, when are you spending time? What are you doing? How are you doing it? One of the things I found, that if you just have 10 or 15 minutes of truly connected and attuned communication, between, whether it's a couple, whether it's a parent-child on a daily basis, it's amazing how you can really build secure connection, even just in small amounts of time. So I often lobby for very small amounts of time. It's funny, I have an 11 and 15-year-old right now, and I used to be able to walk my kids across the street to school for elementary school, and I've had to now drive. Oh my God, parent pickup lines, and oh my God, it's crazy here if you've never done it. But And at first I complained that I spend an hour of every morning dropping, right, getting my kids to school, right? And but I realized it's they're prisoner in my car. It's a great time to connect with my kids. And also at night, after before bed, I go in and I just check in one-on-one and we create this little routine, 5, 10, sometimes it's 20, 30 minutes, but normally it's these short little periods where my kids know they have 100% of my attention. I've got them cornered. But we create these little rituals and that's really, you don't need huge amounts of time. You don't need a parent to take off all of Saturday or Sunday, right? To, I don't know, go to a fancy amusement park. You really are looking at smaller bits of time and, sometimes teaching those disengaged parents how to do that. With toxic parents, normally that makes me think personality disorder. That can be really tough. And so I'm going to coach them as best as I can for how to communicate. So with parents who maybe, let's say, who tend to have a lot of contempt or anger, I'm going to have those conversations and teach them how to have healthy conversations, but I'm going to manage that in my session before I send them out to do homework assignments at home. So I make sure they can connect respectfully in front of me in session and before I send them home with some of those homework. So hopefully that gives you a sense. There are not CEUs available for my YouTube Live. I call these my YouTube Live series because all these become YouTube videos. We don't do CEs because it does cost us a lot to do them. But if you're on my mailing list, which you probably are if you're watching this, I do 2-3 times a year. I'll have free CEs through that. Okay. Woo. So Deb was saying, Deb Zolo just passed her MFT exam. Congratulations. Woohoo. Okay. Oh, Megan's saying, do I offer webinars on working with difficult personalities? Yeah, it's in my Therapy That Works, Unifying Framework. Everyone loves my personality disorder lecture. But I am working, one of these days, I'm going to get a standalone course on working with difficult personalities because boy, it's like you're either got one in the room or you've got a client who's dealing and having survived with a parent or a partner with a difficult personality. There are times where I will say that 10% of the population who has personality disorders, is the one creating anxiety and depression and all the rest. It's a bit of an exaggeration, but certainly weeks in my practice where I feel that way. So awesome. So yes, that is something, it is on my to-do list. I just have a long to-do list is my issue. But yeah, that is on my to-do list along with, I also want to do a course on how to make difficult life decisions. Got a comment or question here from Jennifer. This is amazing. She's been using my materials since she started grad school and she just started Laugh Your Way to Licensure. Awesome. Great. And Jennifer, the Laugh Your Way to Licensure is a monthly session with me, but we have a lot of fun together. So yeah, absolutely. Thank you. Thank you. Hi, William. Aloha. Awesome. Okay. Donald is working on my exam worksheets. And if you're in my Laugh Your Way to Licensure course, absolutely do the worksheets in step 3, which is the deep dive into content, because that is the key. Absolutely. Oh, when do I recommend starting Laugh Your Way to Licensure? At least 6 months, and in some cases 12 months, depends how much you memorized in grad school. So if you didn't have to memorize the DSM manual in grad school or a lot of theories, start earlier since you're going to have to memorize a whole lot. But anywhere between 6 and 12 months, the average person probably signs up 3 to 4 months beforehand, and you can do that, but know that you'll need at least 100 hours of studying time before taking the exam. And I just, I do have if you have extra time, I recommend reading a few books, like on strategic and structural, so that you're like, okay, I know what Jay Haley's voice sounds like, and I got a good feel for him, and I have a good feel for Mnuchin or Satir and these things. So if you have extra time, it's always good because, the licensure process, as I talk about in Laugh Your Way to Licensure, it really should be a joyful rite of passage is what I like to think of it is, because it's where you get to go back and review everything with a little more clinical experience behind you and really own it and become an expert in the field and to feel like you own the knowledge of the field, it. And it should, studying for the licensure exam should not be like cramming for finals in grad school or undergraduate. You really want it to be like, this is my field. I am getting licensed. and I know my stuff. And when you do that, it really can become a cure for imposter syndrome. So I encourage you to get in, because I renew it as long as you need it. You get it renewed, take it, at your own pace, get a sense of what it is. I think if you just sign up 3 months before you're about to take the exam, it can be very more anxiety provoking than if you kind of slowly wade into the process. But everyone's different. I respect your process. I have had someone take the course as little as 3 days before the exam, and I was told I drank it from a fire hose. I don't recommend taking the course like from a fire hose, but she passed. But I like to recommend more 6 to 12 months, so that, because most people, you don't know what you're getting yourself into. So at least you can start slowly and figure it out and get comfortable that way. Awesome, awesome. Okay. Yes. Oh, Deb, who passed, I think, said, yeah, she used the textbook Mastering Competencies. So my Mastering Competencies actually started out as a license prep manual for when Texas used to have its own exam. Every state used to have its own exam. It was I was a grad student and a grad assistant helping someone write the review manual for that, and that became my lecture notes. And then I just kept building out from that. So it's always been part of what I do. Shanna's asking, what can you do for parents who don't do family sessions when treating kids with conduct disorder? Ooh, Shanna, now with Zoom, I would try to get those parents to show up at least once or twice a month. I will tell them I would just tell them the research is crystal clear. If you've got a child with conduct disorder, I need you parents in the room. That is what the research says. There's only so much I can do without you in the room. So I use the research to back me up, and tell them that I'll do the best I can, but it's going to go so much faster and better if I can get you involved. I usually talk parents into it, and with Zoom, it's much more possible. Awesome, awesome. Okay, so Deb was saying, yeah, she started studying a year before the test, a little each day, and she never crammed. Yeah, that would be my preferred style. Like I said, there's some people who drink with the fire, who like the pressure and only work under pressure. And you do you. I respect it. My course is designed for you to do at your own pace. Absolutely. Do you need to study much in the DSM? Nancy, you need to memorize the DSM. Every chapter, every diagnosis, to do differential diagnosis. So all of the major criterion for all the diagnoses technically are free game. So yeah, that is definitely why, if you didn't memorize the DSM once or twice in grad school and didn't memorize at least the 8 to 10 major theories in family therapy, I would start sooner rather than later, because there's only so much the human brain can memorize at one time in history. Awesome, awesome. Very good. Awesome, awesome. Okay. Oh no, memorizing the DSM. Yes, Lena, it's good. You want to have it memorized. You need to memorize to see clients. So yes, and you will not feel like an imposter. Trust me. So yep, you can. And now, I had the DSM memorized for all of my licensing exams, and I've taken 3 of them. Plus, I've taken 2 sets of comprehensive exams, one for my master's degree, one for my doctorate. So 5 times I've had the DSM memorized, and I miss it. I miss having everything like at the tip of my fingers. Now I have to go look things up. But thankfully, the DSM-5 and the 5TR, they've streamlined a lot of the times. The DSM-4 had different time periods for all of the anxiety disorders, and there are fewer disorders in the DSM-5. So yes, you will memorize it. It'll be fun, Lena. You're going to love it. You're going to love it. You're going to have the DSM. You're going to feel confident. It'll make you confident. You will not feel like an imposter. So, okay, everyone, I hope you had a great time. This was great. It's still good to see someone. I mean, all these folks showing up in the middle of a workday. Love it, love it, love it. And I hope you feel inspired and empowered and a little clearer on how to work with families and how to use functional family therapy. Okay, everyone, be well and take care. Bye-bye. Oh, wait, I see 5 other questions. Oh, my goodness. Now okay, I found our 5 questions. This is the problem with having chat and question. Okay, I think I answered this one live. Awesome, awesome. Yeah, yeah. So Ari is asking, can I share this with my colleagues who teach counseling? Of course, absolutely. This is totally free on YouTube. It's kind of like my public service project to the world is And to all faculty members and students out there and everyone studying for exams, yep, here is a lecture for faculty. I started this because I used to travel as a professor and I needed my students to get a lecture. So this is for all faculty who need to go to conferences, for students who feel like they didn't understand what the professor said. It's for anyone and anyone studying for a licensing exam who just needs to do a deep dive. So please share, share, share. And this will be up usually by the end of the week on YouTube. Who initiates the FFT in the family, the functional family therapy? Who initiates it? Usually one of the parents are calling for the teenager. I think that's what you mean. I hope that I answered your question. Yeah, the parents who, and if they won't do it, like I said, I think I answered this question on the other line of questions, but yeah, the parents who don't want to do family sessions, I explained to them that the research is very clear that them being part of the process is going to make this much more effective. And if the parents absolutely won't, then I work with the teen. I work with the teen and I tell them, you're going to have to figure a good way out of this, yourself. We're gonna work together with you to help you create a beautiful life that you love for yourself. So then I align with them to help them get their life going in the right direction for them. And we'll deal with their parents as that comes up, but I will work with the teen absolutely. And there's a way to do that, but I do try to get the parents involved because I think it is so, so important. Okay, awesome, awesome. Thank you all. I wish you all a great rest of your day. Take care. Bye-bye.